Now, to all of you, good morning, good afternoon, good evening, depending on where you are in the world. My name is Karen Chavez. I work for the Global Partnership as Program Manager for the Caribbean and Latin America. And we are starting this session in which we will present specific examples of capacity building projects that the Global Partnership has conducted, providing a clearer understanding on our way of working. We are also going to share the knowledge gained in country projects, since these experiences could be used as a guide to follow for other countries. We have 1 hour ahead of discussions, and I will be sharing the moderation role with some of my colleagues, and we also have a mix of prep speakers that we are going to introduce properly before they start talking. The agenda of this session is opening remarks, country examples with presentations made by the leaders of the country project, followed by some discussion. You can participate making questions via chat, and then we have some wrap up and closing. And with no more preamble, I'm happy to introduce for the opening remarks to Davis Adieno, Senior Director of Programs at the Global Partnership for Sustainable Development Data. He works across sectors through national data roadmap processes to define strategies that support their priorities for investments and innovations in data. With accumulated decades of senior experience and continued success in the data for development sector, Davis, the floor is yours. Thank you.
Thank you so much, Karen, for that comprehensive introduction. I wasn't expecting it, but really glad to be here. And welcome to everybody. We are doing very well in the chat. As we can see, the diversity of participants from across the world is really impressive. Thank you so much for taking time out of your very busy schedules to join us for this really important webinar on sharing. That's what we are all about, sharing our experiences on capacity building and harnessing innovations and technologies, really to tackle one of the most pressing challenges I've just come from the US, and it's interesting because when you look at the intensity of natural disasters, the two hurricanes that have hit Florida in succession, when you look at the level of the devastation, you realize this is a really important and critical challenge. And we, as the Global Partnership, are really established to work with all of you as a global network to use data not only to achieve sustainable development goals, improve the lives of people across the world, fight inequality and promote environmental sustainability, but also respond to some of these really emerging challenges. We work on three main areas. Maybe just to briefly introduce the Global Partnership, the timeliness of data. And this is so important in terms of providing the tools, the methods, the approaches, and having forums like this where we can share learning about how other countries are deploying innovative methods and approaches to solve some of the challenges that they're facing. And then secondly, we work on inclusive data, which is pretty much looking at how do we include communities that have previously been left out of data, and properly plan both at the data collection process, the management and application of that data to understand some of the challenges and include them in the data. And then lastly is accountable data governance, which is a really important area. The data in itself is really important, but the normative frameworks that govern how that data is produced, issues around privacy, data sharing, and the emerging concerns around emerging technologies can need to be addressed really as an important component. And therefore, having citizen voices in how their data is produced and actually used is really, really important. And I'm glad that we are having this webinar and peer-to-peer exchange on the 15th of October, which is the Caribbean Statistics Day. And so in the Caribbean today, they are celebrating their Statistics Day, and this comes at a really important point. So we welcome all our participants from the Caribbean, and we wish you the best as you continue to advocate and elevate the really important aspect around data and how it can be used really across all data communities through collaboration and partnership to tackle the issues that we face. But briefly, just to say, we do understand that when you look at all the three aspects of what we work on together with our networks, capacity gaps, skills gaps still remain. And therefore, one of the major areas that we focus on as the global partnership is capacity building and capacity strengthening. And so we work with a broad spectrum of partners to deploy and test different methods of capacity building, be it in data science, be it in Earth observations, citizen-generated data, strengthening administrative systems, and everything. Through experiential training, through data fellowships, we work with all of you to develop innovative tools and methods that can be shared across our network, and for the partners really to learn from others what they're doing and adapt it and contextualize it in their own regions. And so when we have forums like this, we do appreciate, and as you are all practitioners, we look forward to learning from you after you hear from the partners who will be sharing their innovations. We do hope to hear from you and learn from you, even as we facilitate this particular webinar. And feel free to reach out to us, even as we, towards the end of the webinar, reach out to us if you need more information. More importantly, if you want to be connected to other countries and other partners who will be speaking during the webinar, feel free to contact us, and we'll be delighted to do so. Thank you so much for those remarks, and I hope that you're going to enjoy as we move forward. Thank you.
Thank you so much, Davis, for the opening remarks. Now we are ready to move to our next session of the webinar, the country presentations. And for this part and for introducing our first country, I will hand over the moderation to my colleague, Francois. Francois, the floor is yours.
Thank you so much, Karen. Thank you, all attendees. It's a pleasure being here. So good morning for some of us and good afternoon for some of you. Good day to everyone. I am Francois Camano, and I am engaging all the Francophone countries in Africa on behalf of the Global Partnership for Sustainable Development Data. So it's a pleasure for me to share this event with you. So today I want to tell you a story, which is just imagine learning something that helps not only with the environment, but something that also helps both with the environment and also with the healthcare. And yes, this is what's happening in Togo. The government of Togo, with the help of the Global Partnership and the Islamic Development Bank, we started a project. So the project was to help the government officials and civil society representative, private sector representative in a very inclusive way to, help them learn how to use data, especially about the environment and the climate change. So this training, we were calling it in Togo, training of officers to strengthen, the environmental data and climate change information system. So out of this training, one person in the name of Basaga Kosi Simle, he's a medical assistant working at the Ministry of Health. After the training, he used what he learned to help fix a problem in the healthcare sector. So I want to, with your great attention, I want you to be ready to hear, this story from Basaga Kosi Simle. Basaga Kwesi Simle, over to you. Thank you. His mic is it open? While we got him on board, his story shows how learning new skills can change not just the environment,
Oui,
but
je
also
suis
help.
là, je suis là.
Okay, all right. So, à vous la parole. Over to you.
D'accord. Merci beaucoup.
Thank you so much. We're going to introduce the work that we did. And for this, I will ask for you to allow me to start screen sharing. I hope you can all see my screen. Yes, we can see your screen. Thank you. So thank you to all of you. As this was said by Mr. Kamano, I am Basaga Kwasisi. I'm a medical assistant and specialist in computer science and data management. I am working under the Ministry of Health. I would like to say thank you to all the panelists who are joining this, attending this webinar, and most particularly our partners, namely the Global Partnership for Sustainable Development Data and the Islamic Development Bank for the crucial support to this project. Thanks to their collaboration, we were able to improve and improve our capacity in the management of environmental and health data. I would also like to say thank you to Colonel Umune Desal, who is the coordinator of the project, as well as to Dr. Jacques-Aimé Jogan. He is an expert in hydrology and in remote sensing, and also to GSLT consulting firm. Today, I would like to give a case study presentation on the use of GIS tools to improve decision-making in public health in the case of Togo. We will discover how these tools have made it possible to have a better visualization of health indicators, which have facilitated more strategic interventions under our health system. Before going deeper into this topic, with your permission, I would like to give you the background to improve environmental governance and enhance the quality of life of its citizens. The Togolese government has joined forces with the Global Partnership for Sustainable Development Data with financial support from the Islamic Development Bank to build its environmental data management capacity. This collaboration led to the launch of a project entitled Training Agents to Strengthen the Information System on Environmental Data and Climate Change. The initiative aimed at equipping professionals from various sectors with the skills needed to effectively manage and visualize geospatial data in support of the Sustainable Development Goals. This is the occasion that enabled me to leverage the skills that I learned from the training in order to tackle some of the urgent needs that we had and that were arising in the health sector. Now, for the problem statement, the lack of use of GIS tools for the management and the visualization of environmental and public health indicators in Togo, which does not allow for a effective representation of geospatial and public health data such as disease prevalence and access to healthcare. Consequently, decision makers do not have appropriate maps for them to come up with good decisions on resource allocation and intervention strategies. Now, to address this challenge, we have introduced GIS tools in order to improve the management of geospatial tools and improve decision-making in the health sector. Before moving on to the findings that we came across, that we actually provided as a result of this exercise, we would like to first of all talk about the results achieved through the application of this training skills. We actually learned about some tools such as QGIS and SQL, which is a database management tool, which enables us to come up with a specific representation of maps on given indicators in order to be able to locate vulnerable regions. We've also acquired some skills on the integration of geographic and health data for better visualization and management of public health resources. Under this, I would like to remind you that in Togo, we have a data collection system, but we have to notice that those data are not georeferences. And this work allowed us to integrate both data and indicators that are extracted from that system, as well as the map in order to come up with a specific representation that will allow for us to conduct a comprehensive analysis and come up with adequate decisions. We have also acquired skills for the development and management of geospatial database to store and process health-related data. And we didn't stop there. During that training, we have also learned to do data analysis in order to come up with decision making, in order actually to help decision makers to come up with good decisions. Now, what are the results achieved through the application of these training skills? And I will illustrate this with two maps. The first map illustrates the suppression rates of viral load in Togo. And this map, as you can see this on this screen, it actually illustrates regional variations and the effectiveness of the rates across the country. And the rates varies between 15 to 35%. This is the lowest rates, and the highest rates are between 15 to 100, with intermediary zones which have moderate rates ranging between 35 to 55%, and the medium rates are between 55 to 75%. We can notice that the regions that have low rates, such as some of the rural areas with savannas, and this is namely the region of Togo, in the northern part of Togo and Kara. These are areas that are exposed to several challenges regarding the access to healthcare. And this is caused by either the lack of health facilities or lack of appropriate healthcare. And for moderate rates, this can be in the areas such as in the region after the central region when we go southwards. This indicates partially effective management of patients, but still we need improvement on the high rates is located in the urban areas such as Lomé and other areas, but of course such as Lomé, and this testifies of a good healthcare and a good follow-up, and this illustrates the necessity of targeted intervention in order to improve effective access to healthcare in order to reduce the viral load. I would like to remind that this work is contributing to achieving a specific objective, which is part of the Sustainable Development Objective, which says that by 2030, we have to screen 95% of people living with HIV, and those 95% of people, and that 95% should be put under ARV, and 95% of people screened to be under ARV, and the viral load should be cancelled. When I take the Lomé area, where we have a coverage of about between 92% and 93%. So this will allow for us to really ensure that we take charge and take actions in order to reach the 95% goal. The second map is regarding the access to healthcare and health facilities. This map illustrates important elements in the availability and the use of health services across the country. In the areas with low access, as you can see in the map, from 35 to 50%, are normally located in areas around the savannah, basically the northern parts of Togo, and this only give a restricted area to health facilities due to geographical locations, or due to lack of infrastructures or socioeconomic barriers. Moderate zones are such as those that show and demonstrate the regular use of health facilities, but which still require some improvement in order to improve the availability and service quality. And areas with strong access are generally located in more urban areas such as Lomé and its surrounding areas. So you can see that there is an issue at this level. And
il ne vous reste plus assez de minutes, donc c'est mieux
you only
d'accélérer.
have a couple of minutes, so we would like for you to hurry up. Okay, thank you. Well, after coming to these findings, now what will be the next steps? So I have to tell you that these results and findings will be presented to a public health decision-making meeting, and we are also going to come up with ad hoc and appropriate measures in order to improve the work and submit this to decision makers for them to come up with adequate solutions and improve the health of the population. Now, in terms of recommendations, as I was saying, on the basis of the data analysis, we have formulated a number of recommendations in terms of improving health infrastructures in regions where viral suppression and access to care are low. Intensify public health campaigns in regions where results are moderate in order to promote better use of antiviral and health services, maintaining and reinforcing successful interventions in high performance zones. This will be the end of our presentation. We are available for your remarks and suggestions for us to improve this work for the benefit of our entire community. Thank you.
Thank you so much. Thank you so much, Mr. Basaga. Thank you for your great presentation. So, as we have seen, his story shown how learning new skills can change not just the environment, but also help in other important areas like healthcare. So, in summary, Mr. Basanga explained that in Togo, it was hard to make good decisions about healthcare because they didn't have tools to show where diseases are and or how many people have access to healthcare. So he made health maps to show important things like how many people can access healthcare and how well different areas are doing. From the data, he gave three important ideas. First, to build more healthcare centers in areas that needs them. And secondly, to have more health campaign in areas that are doing okay but need improvement. And lastly, he said to keep supporting the area that's already doing well. So this is the end of the story that we were trying to tell you about Togo. I'm going to give you some few minutes if there is questions and comments before we hand it over to the next moderator for the next session. Is anyone having any question, any comment? You can write it in the chat. Also, we can read. If you don't have access to the mic, we are also monitoring the chat. You can put it in there. If you have any questions or comments that you have on the presentations made by Mr. Dr. Basanga Kusi, is a medical doctor also. Okay. In the event that you come up with questions, we can still take them at later stage of these sessions. But I want to thank you so much for your attention, and I'm now going to give the floor to my colleague Freddie to take us through the next sessions. Thank you so much.
Thank you, Francois. I'm trying to turn on my camera, but apparently I cannot do it. If someone can allow me to turn on my camera, thank you. So good morning, afternoon, evening to everyone. I'm Frederick Rodriguez. I'm the Senior Latin American and the Caribbean Regional Manager at the Global Partnership for Sustainable Development Data. I'm originally from Colombia and I'm based in Colombia as well. And I'm actually very pleased to join this webinar. I see a good number of people that has joined us today, especially from different countries and regions. So it makes me really glad to see that a lot of people is trying to learn about the experiences from others. It is actually a privilege to introduce Valentin Mo Sosi. She's an expert in land use and land cover monitoring at the Foundation for Forest Management and Production in Suriname, with a strong foundation in environmental science. She also focuses on advancing monitoring techniques and also analyze land use impacts on ecosystems. Valentin actually will be presenting today the findings of a report, Data to Monitor Environmental Impacts in Suriname, a small-scale gold mining study. This report was launched together with different colleagues of Suriname, the Global Partnership, the Inter-American Development Bank, and the Islamic Development Bank a couple of weeks ago in Paramaribo, Suriname. So it's actually this launch that was done 2 weeks ago is bringing us very good and new information about small-scale gold mining with the case study that was developed in Suriname, but also the opportunity to connect with policymakers. So we had the opportunity to launch the report with a good number of organizations, institutions from the government that are related to mining, to spatial planning, and also environmental protection. So they actually realized and they were really glad to see the inputs of this report for decision making. Without further ado, let me actually give the floor to Valentin, and also please keep your questions as well for the end, or if you have any questions during Valentin's presentation, please post those questions on the chat box, and we will be happy to address them at the end of Valentin's presentations. Thank you. Valentin, over to you. Thanks.
Yes, good day to everyone. Thank you, Freddy, for the introduction. I am Valentin from Suriname, and I will be presenting in English. And actually, we are like a Dutch-speaking country, and we're the only Dutch-speaking country in the South America. But so hereby, I want to excuse me for my English. I will do my best. Let me share my screen. Yeah, I will turn off my camera now because my internet is not that well. So I will present to you the data to monitor environmental impacts in Suriname. As Freddy mentioned, we have released a new report. Yes, we look at the timeline of the capacity development program in Suriname. We started actually in 2022 when we had the initial engagement with the global partnership. And actually in May 2023, we looked at we had more than 10 virtual sessions. We looked at the thematic areas to focus on the data needs, the knowledge exchange, and the training, the capacity needs, and the institutions that needs to be involved. During these sessions, a lot of stakeholders were also involved to also add to the training needs. In June 2023, we had a training, and in November, we did more than 7 co-creation sessions with Asimila. Asimila was a trainer for this project, where we have developed a technical report, we defined the case study, and we have results for a pilot area. And in 2024, recently, we have launched a policy reports, which is based on the data produced from the training project. So about the partnership, this partnership is between the Islamic Development Bank, the Inter-American Development Bank, and the Global Partnership for Sustainable Development. in collaboration with Suriname counterparts and Asimila. And this training aimed to facilitate coordination among national institutions to ensure a multi-stakeholder and collaborative approach to technical data solutions. It aimed to create a common agenda, to develop a case study on artisanal gold mining in Suriname. And the last aim is to create medium and long-term technical capacity on Earth observations data analysis and use for more than 16 entities in Suriname. So with this partnership, there were 3 institutions that were leading this project nationally. And that was the Foundation for Forest Management and Production Control, where I'm working at. We have the General Bureau of Statistics and the National Planning Office. The report is released and you can find the link to the report in the presentation. Yes, when it comes to gold mining in Suriname, it represents more than 30% of the gross domestic product, and 5% is associated with mining and quarrying activity. And to improve the data availability, the remote sensing was combined with machine learning, where we have done a classification for the years 2019 and 2022. And changes in the forest coverage and water body were used to estimate the environmental impact of artisanal small-scale gold mining. When we look at the main results, within an area of about 700 square kilometers, that was the pilot area, we have seen an increase of 47% of gold mining in 2022 compared to 2019. There was a total loss of about 25 square kilometers of rainforest if we do the comparison between 2019 and 2022. And also we have seen an increase of 40% in water turbidity between those 2 years, and an area of about 6 square kilometers of rainforest experienced more than 10% drop in vegetation health. What data already exists in Suriname? So as you can see in the map, we have actually low deforestation rate. We are still a high forest of a low deforestation country with a deforestation rate of between 0.06 and 0.07%. We still have a forest cover of 92.61% for 2022. But as you can see in the map on the right, we see that mining is the biggest driver of deforestation in Suriname. And it's mostly located in the east of Suriname in the greenstone belt. So mining accounts for 65% of all deforestation, followed by infrastructure with a percentage of 19% and agriculture with a percentage of 5%. And gold mining became a very attractive income generation activity in especially eastern Suriname. And for a large scale of households in the interior, gold mining is the primary source of income. And these miners don't have the knowledge to sustainably use the land. They typically fell and burn trees, and they have no information on the use of soil for deforestation purposes. And small-scale miners fail to extract an estimated of half to 2/3 of the gold mining in the soil because of their techniques. So artisanal small-scale gold mining is difficult to monitor because of the accessibility, but remote sensing gives the solution for that. So when we look at Earth observations, it's vital role in environmental monitoring because it associates space with statistics, and it is gathered on scale that is really large, and satellite data are freely available for us to use. So we only need the capacity to use this data. Open source machine learning models are becoming more prevalent in the field and can be more accurately distinguish between the land coffee types. And as I mentioned before, the data is freely available and it is of sufficient quality. Yes, the case study for this partnership was in the north of the Togo Lake. In this area, there is a lot of gold mining, and we are like in the greenstone belt where more than 90% of all the gold mining take place. Yes. When it comes to the case study, the processing involved to derive annual land cover maps, and that was for 2 years, produced for 2 years, for 2019 and 2022. Machine learning classifier was trained using training data set. Together with other participants, we reviewed this data set and the classifier was trained. And a lot of classifiers were used, but the one with the best results was used for the whole study area. And the key findings I have mentioned before, so I will not go into that one, and the recommendation and lessons learned. So institutional and national capacity considerations. And within this pilot, we were able to increase capacities through in-person training and co-creation sessions. And there have been recommendations of programs to keep advancing in skills. So this was actually the basis of training in Earth observations. We see that users like to visualize their data to have a better understanding of what is actually happening. So with this training, we can see increased motivation of users to more get involved more with Earth observations data. Institutional participation. When it comes to institutional participation, it was crucial for gathering training data and fostering a collaborative environment. And the proposal is to create a group of institutions to foster and promote Earth observation data analysis on small-scale gold mining. We want to widen the case study. We already monitor the land on yearly basis, but gold mining is a really big driver of deforestation. So we need to work together on this specific topic to have on-the-ground solutions. So another proposal or another recommendation is to make participants freely available, because if it's not included in their daily tasks, it's usually a challenge to work with this kind of data or to improve your skills, because you will need the time to build your capacity on Earth observations. We have some limitations when it comes to the IT infrastructure. So in this case study, we use some cloud computing resources, and the recommendation is to improve the existing cloud computing skills and to aid the generation of various Earth observation-derived environmental data products, not only those related to small-scale Earth mining. And another technical recommendation is to explore the possibility for an aid of a graphical user interface. And with this, I would like to thank you for your attention and give the floor to the host. Thank you.
Thank you, Valentin, for that comprehensive intervention. Sorry. That was really good, and just to add on that presentation is how the collaboration with different counterparts in Suriname has actually been very successful, especially bringing different institutions of the government and also policymakers aware of the impacts of small-scale gold mining in Suriname. So let me see if we have any questions on the chat box, or if anyone has hand raised. Let me see.
Freddie, there's some questions in the Q&A section.
Oh yeah. Did you use satellite missions data? And let me try to read them, Valentin, so that you can actually go through them. Did you use satellite missions data? The other one is, did you explore the use of FAO GIS analysis platform? And the other one is for Togo. So I will just read it and then give the floor after Valentin to our colleague from Togo to reply to this question. What are the steps you will advise based on the implementation in such a project? So Valentin, please, can you start answering these questions, and then we can hand over to Togo. Thanks.
Yes, thank you. We used for this pilot study area, we used Sentinel-2 data. And another question is if we use the FAO's GIS analysis. For this study, we haven't used the FAO GIS analysis platform, but within our regular production of data, we use the CPAL platform, also used by FAO to do the quality assurance and quality control of the data. And that were the questions for me, right?
Valentin, since we have you on board, and maybe we can come back to our colleague from Togo. There's another question about why we use data from 2019 and 2022 for the analysis.
Yes, these years were chosen based on the already existing data of those 2 years. So that data set can be used to validate the data produced from the study area. And also the study area was chosen based on the data we have in the field. And currently field data is being collected on carbon estimates. Yes. Kevin, back to you.
Thank you, Valentin. Let me hand over to Basaga from Togo. Maybe he wants to answer the question that was posted on the Q&A chat. So Basaga can, yeah.
Well, thank you. Well, the question was to know what would be the steps to go through in order to achieve such a project. I think that was the question, was it?
Yeah, that was the question.
All right, thank you. Well, I think the very first thing to do is to have the skills, and this was acquired to us thanks to this training. And once you have those skills, those hands-on skills, then you have to move to data collection. And regarding data collection, it should be either data in terms of health indicators data, such as our case. And for those data, you have to go to the sites. And when I check websites such as GIDM, where I can download the maps, and Google GIS can also help us collect maps. Regarding health indicators data, we have a data collection system. That's where I actually put my data in. But you can actually collect data and put them on your own platforms. And then you can move on to data analysis. And then you later use data with GIS. We had the skills which enabled us to represent those data on the map. So in summary, this would be the steps. But then this will be in addition to my presentation. I would like to specify that the training that we received enabled us to have an idea of creating a platform for experience sharing. And at this point, I actually uploaded videos on YouTube on the use of GIS. Since in our country, in GIS tools, as in our country, we did not have GIS data. So I actually wanted to share the experience with my colleagues. And as this was not possible, as it was impossible to move and do that in person, I made it possible to do it remotely, and I used a platform whose link I just shared in the chat, and I uploaded a video on the integration of health data with geographical data such as these maps backgrounds. Thank you.
Thank you, Mr. Resaham and Mrs. Valentin as well. So thank you for your presentations, for your insights. I know there might be additional questions related on the coordination and how was the process in each of the countries. We might be able to share additional information, but let me hand over for the closing to my colleague Anita, who will be actually letting us know on the next steps as well.
Yeah, thank you so much, Valentin and Monsieur Basaga, for the presentations. We wanted, of course, this to be a space where we're sharing the knowledge that we've learned from the various projects that have been done both in Suriname as well as in Togo. And of course, there's a lot of things that are involved, especially when it comes to large-scale projects that go over various years. And I know that we didn't capture that well, but this is more of an introductory webinar, and we will have more of this in the coming months, where we'll look at different countries or even focus more on the specific projects that have been shared. But I want to thank you again, Valentin, as well as Monsieur Basaga, for going over this very innovative project, as well as giving us a look into how countries in the Caribbean as well as in Africa are actually looking beyond just the use of traditional data methods, and they're actually seeing how they can use different data points to be able to harness data for climate action. So I want to thank you, everyone, for your rapt attention, and also for the questions that you shared with us. I want to thank our various moderators for the different sessions, and also to the work that we do at the Global Partnership. I want to thank our various team members who've come to support and to give us and who have provided us with a lot of the work that we've needed to do over the last few weeks. So thank you, everyone, and I wish you all a good day. Also, before we close, I will be setting up a poll just to hear more about what you think about the session. So if you could kindly spend a few minutes before we leave to fill this in. This also helps us understand how we can improve this event because it's going to be the first of many. Thank you, everyone, and have a lovely rest of your day.